Gutkin, and I'm going to be doing a complete head-to-toe physical on my subject, Chris, who's 6'1", 216 pounds. We've already taken his weight and his height. I'm going to take his temperature. I'm going to just stick this in your ear, Chris. The minute it goes in there, we have to get another one. Fresh. There you go. I let it sit around for too long. Okay, it's taking your temperature. .3. Chris, I'm going to be doing a complete head-to-toe physical on you. Okay. And what I'll do is I'll explain everything as we're going along so that you know what we're doing. We've asked you a bunch of questions already, but I'll take some notes and write them down as we do it. I'm going to write your temperature down. Now I'm going to take your blood pressure also. Your temperature was 96.3. Are you too cold in here? Do you feel all right?
I'm fine.
Okay, let's take your blood pressure. Do you particularly care about which arm? I'd like to go towards this arm.
I'm a lefty, so.
Yeah, well, basically this is where your heart is. So we're going to take your blood pressure. Okay. That's backwards. I've never used this cup. Yeah?
Yeah.
Okay.
No, I'm down. I did learn that.
You know, as it's pumping it up. You feeling okay today? Even hums for you while you're doing it. Takes just a little bit of time. Just relax. .163 over 96. You said you had been. Your
That's about
pulse
right.
is 63. That's fine. Have you been to the doctor?
Not for this, no.
I think you ought to, unless you want to pull it out.
It fluctuates. I just got it done
What was it before?
Tuesday, and it was 134 over 82,
Okay.
which is a little better.
Yeah, 82 is fine. So it's pretty much like you said before, it's labile. It means it goes up and down.
Yes. I couldn't get it during surgery under 160 over 100.
I wonder if that's the result of the surgery itself.
And stress. I tried different, I think 9 different high blood pressure medicines, and none of them worked.
Oh, wow.
That is different. Okay. Your pulse was 63. You run a pulse like that? About 63, is that about normal? Okay, I'm going to start, the first thing I'm going to do is do an assessment of your skin, and I'm going to do it by, I'm going to do the assessment based upon different, first your skin, then your head and neck, different systems, okay? I'm just going to be looking, I wash my hands, his hair is clean, his scalp is dry, his skin is reasonably warm to the touch, which is perfectly normal, sparse of hair on his chest. He's freckled. I don't see any moles on the back. I do see moles on your neck, but they're round and symmetrical. One is a little bit raised, but it doesn't look angry, and it doesn't look all that big. I've got a couple of cherry angiomas on his shoulders. His back, he has 3 moles and a ton of freckles. He does have 1 small mole on his back here. I notice that there's a tattoo, and I'm trying to see what it is. What is that?
I think think it used to be a head wanting something.
What happens? You grow bigger and it got bigger?
That was one of those stupid kid moments.
I noticed there's a long incision on his abdomen and another shorter incision where it looks like he had a colostomy. Is that correct?
Yes.
Okay. Is it, I know it's not there anymore. It's been re-anastomosed, obviously. His skin is dry. There's no oiliness at all. His knuckles are a little bit dry. His hands are knuckles are a little overly dry. Is that from working?
This is psoriasis.
He's got psoriasis on both legs. What about your arms? I don't see any on your stomach or your arm.
Elbows, knuckles. And
Okay,
shins.
psoriasis on his elbows, knuckles. Okay. I don't notice any suntan. Your skin is kind of a moderate complexion, medium complexion. I'm going to try something. Put your shoulders down for me. Your skin turner is normal and very elastic. In other words, if I pinched up and it stayed up like something like this, then there would be an issue.
Too dry.
Yeah. Well, it generally means that you're dehydrated.
Right.
Okay, I've noted the nose and the scars. Let me look at your nails. They look pretty thick. Thick nails? You having trouble with them? You feel any pain or anything like that? Okay, can I get you to kick your shoes off for me? Does the psoriasis, nails are clean, no funguses.
Yeah.
They look all absolutely thick like your fingernails. I think they look pretty healthy. How do you feel about them? Do they hurt?
No.
Okay. Your ankles?
Ugly feet, but.
No, I don't think anybody has ugly feet. As long as they serve their purpose and you can walk on them and they don't hurt when you walk, and then there's nothing ugly about them. Okay, now I'm going to look at your head and neck.
Okay.
Okay, I want to feel for your, put your hand up for me. Okay, just feeling the frontal lobe and the temporal lobe. I can feel the fissures. They all seem normal. There's no raised frontal, occipital, temporal. I can feel the fissures. None of them are raised at all. They seem perfectly normal. No dimples. Okay. Okay. Your eyes are bilaterally symmetrical on your face. Your nose is a little bit tipped to the left. Do you ever break your nose?
Yes.
Okay. How many times?
Once.
Okay.
That's all it took.
Hmm?
That's all it took. One.
Was it a fist fight?
Fist fight.
Yeah. All you have to do is get hit one time, and that's
They
it.
kind of gripped it over
Do
a little
you
bit.
shave often, or is it just back and forth?
I shave
Okay.
regularly.
Does it bother you when you shave?
Yes.
Okay. Is it like it develops a rash? Is it
Yes.
because of the psoriasis?
No. It's
Okay.
just razor,
Yeah.
really sensitive skin.
Yeah. Okay. Let me look at the top of your ears are just right in line with the outer canthus of your eye. If you had a Down syndrome, your ears would be lower than your eyes, but they're perfectly normal.
Yeah, but they're crooked. If you look,
Whoops, I think that's the way.
one's lower than the other.
Not very noticeable.
When they do
Not
my
very
glasses,
noticeable.
they have to about twist my glasses.
Your eyes are pretty symmetrical. Your ears are pretty symmetrical. Your nose, except for tip to one eye, your nares, your nasal openings are symmetrical. I'm just looking at them now. Your mouth is normal looking. There's no blueness on your lips or anything like that. Your skin is perfectly clear. Have you ever had an acne problem or anything like that?
Absolutely.
You're one of the lucky ones. Can you move? Smile. Okay. Move your mouth left and right. Okay, you got normal smooth facial movement. Okay. Let me look at the folds right here, pretty even. This is what I'm looking at, these nasolabial folds. They're pretty even. You don't want them off because that's like a palsy when one side is a little bit, it moves a little bit less. Okay. Your skin is clear. I'm going to do something real quick. I just want to feel if I can feel your temporal arteries. Absolutely. got good pulses in your temporal arteries. They're 2+, which means they're perfectly good. Do me a favor now. The last thing I want to do is I want you to open and close your mouth. I don't feel any clicking. It opens and closes normally. Do you always move your mouth a little bit to the left or right when you
No,
open?
that's just from the, I just had the tooth pulled out.
Oh, that would make you do it.
I had a molder pulled out 2 days ago, so I'm a little.
Okay, your TMJ looks perfectly normal. Okay, let me feel your neck. I don't feel any swelling in your neck. You got a nice Adam's apple. Does your neck hurt at all?
I've got this, I think it's related to the, you feel a little knot right here?
Yeah, I think that's just a little lymph node. Okay.
Or is that related residual from the,
It may be.
from the tooth?
It may be. There's 2 things that I know for sure in this world, or 3 things. 1, there's a God. 2, it ain't me. And 3, I'm not a doctor. So I'm not gonna be able to tell you that. Lymph nodes tender in the back of your head?
No.
Okay, I'm palpating his sinuses. Any tenderness at all?
Mm-mm.
Okay. Any tenderness of the bones right in here?
No.
Okay, that's fine. I'm gonna move on to looking at your neck. If you'll just look straight. His throat is midline. Doesn't go to the left. He has a prominent Adam's apple. He's got no lymph nodes except 1 on his left-hand side. His neck is clear. Got a lot of hair on it. But other than that, turn your head to the right for me. Now to the left. Okay, does it hurt when you move it? No. He's got range of motion 90 degrees in each direction. Okay, I want to see if I can palpate your carotid arteries. Oh God, yeah, you got great pulses in your carotids too. There are 2+ in each. His trachea again was midline. He's got a nice Adam's apple. I'm going to look at your eyes now. We did his vision before. It's 2100. We didn't bring it in here to get the exam room because of the distance. There's not enough distance to do it with the eye chart. I'm going to move this pin to the left and the right of you. Keep your eyes looking straight and tell me when you can't see the pin. Look straight. When you can't see the pin anymore.
Gone.
Gone right there. Okay. Okay. Just let me know when you can't see it.
Gone.
Okay. He's got about 170 degrees in each direction, which is within normal limits. I'm going to make a note here on your peripheral. Okay. I'm going to look at there's 6 fields of gaze that you have. Okay, can you see this?
Mm-hmm.
Can you see this?
Mm-hmm.
Can you see this?
Mm-hmm.
Can you see it here?
Yes.
Here.
Yes.
Here.
Yes.
Here.
Yes.
Can you see it?
Yes.
Can you see it here?
Yes.
Your perfectly normal 6 fields of gaze that you're looking at. I'm going to explain as we go along. Okay. I'm going to ask my assistant here, who's very lovely, to dim the lights for me. I want you to look at me. Do it again. Here we go. Okay. You can turn them on. Thank you. Now I want you to look at this. He's got, his pupils are equal, round, reactive. And now I want you to look at my finger. Okay, just look at my finger. Now. Okay. Notice how his pupils got bigger as I moved in. That's that's accommodation. His eyes are accommodating to the distance that it has. In other words, your pupils are going to change size based upon how far away I am, that the object is. The closer it gets to you, the bigger your pupils are going to be. And that's what we call it. Your pupils are equal, round, reactive, and accommodating the light. Okay, let me look at your eyelids. Okay. Does anything bother you in your eyelids, your lower eyelids, or anything like that? Okay. You have sweat bags underneath your eyes. Do you sleep well?
No.
Okay. Is there any particular reason that you note?
Don't get good sleep lately.
Okay, look up. No, look. Okay, his eyelids are covering the top arc of his iris, which is perfectly within normal limits. Let me look at your conjunctiva. Your eyes are moist. Your sclera is white. I don't see any broken vessels. I don't see any scarring or anything like that on your eyes. Let me look on the other eye. Your eyes are actually pretty bilaterally symmetrical, and you've got nice eyebrows.
Thank you.
Okay. I mean, I wouldn't go think
That's
that
a
you could
first.
be a movie star. Okay. Let me, let's see about your lacrimal gland. Okay, I'm not gonna hurt you. I don't feel any lumps or anything in his lacrimal gland ducts. There's no swelling or there wasn't any tenderness, was there?
No.
Okay. And let's look at your ears. They're not red, are they?
Mm.
Okay. They stick out from your head only mildly, about 20 degrees, which it is. You know, that's not bad. When you look at my father had ears like a Dumbo the elephant. I don't. There's no swelling in your ears. Can you turn that way? Okay. Can you hear me?
Yes. Yes.
Positive for the whisper test. He heard me. You ever have any problems with your ears?
No.
Why don't you stand up for me? Okay. His ears are symmetrical bilaterally. I want you to close your eyes. Okay, put your arms down by your side. It's got a normal Romberg test. Romberg test is normally if a person has a problem with the inner ear or they have a problem with the nerves in their legs, they will start swaying like this, and the little bit of sway that you have is perfectly normal. Okay, your nares. I'm gonna take my light and look up your nose. Oh my goodness, is it clear? Do you have any trouble breathing?
Is there a brain up there?
I don't see anything up there, nor do I see a bat in the cave. Yeah.
No, I do not have any difficulty breathing.
Do you palpated your sinuses? They're clear. Well, okay, I'm going to take your pulse like this. Let me use this hand. Let me put it across your chest. I'm going to look at it this way. Actually, that's fine. I wasn't really taking your pulse. I was counting your respirations. And your respirations are 16, which is well within normal limits. And the reason I didn't say anything to you is I didn't want you to change the way you were breathing, because a lot of times when you say something to somebody, all of a sudden it's like, and they hold the breath. When I was in nursing school, and you had to do that on a partner to pass an exam or a test, a skills test, they would slow it down, their breathing, so much so that it would only be 6 or 7 breaths a minute, so people could actually count and be right in there. It's kind of cheating. Anyway, your skin color is normal. Your fingers aren't clubbed. They are, you got normal capillary fill, less than 3 seconds. I don't see any blue or cyanotic, any cyanosis at all on your lips or any part of your body. I notice you breathe with your stomach.
Mm-hmm. That's because of this.
Does it feel better to breathe that way?
Mm-hmm. Well, right now it's sitting on my diaphragm.
Okay.
Incisional hernia.
Note
So
that there's incisional hernia.
It's sitting on my diaphragm.
Yeah.
So it kind of makes it difficult to breathe.
If you breathe, take a breath and lift your chest up and tell me, does that hurt?
No.
Okay. See, normal breathing would be You breathe with your stomach and your chest at the same time, but I notice your chest doesn't move at all. It's just basically here. That's called using accessory muscles. And because your stomach becomes an accessory muscle to help you breathe, to help push up your diaphragm. A lot of times that shows a breathing problem. In your case, it's probably due to the hernia that you have. I'll note that his sternum is midline. The sternum is your breastbone. It's directly midline. It's not moved to one side or the other. Again, I don't see anything that raises any shape of his chest is 2 to 1. In other words, if you had COPD, your chest would be as far back as it is wide. But now it's 2 times, this is 2 times wider than this. Okay? And that's perfectly normal. If you had COPD and tough, you'd have a barrel chest. Your chest would be like a barrel. And you have none of those signs of that. The movement is nice and smooth. I don't see any clubbing of the fingertips. Now I want you to do something for me.
Okay.
Say 99.
99.
99.
99.
99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
What I'm testing for is something called tactile fremitus. Fremitus is when you say the word 99, I can actually feel it vibrating through your chest. If I didn't feel it vibrating, it means that there's something solid there that I'm touching. As I move down, if I touch something solid, like a solid mass, I wouldn't feel any vibration at all. Okay? I felt nothing but vibration, like 6 or 7 points, 8 points on the front, and about 10 points on the back. So you have a normal tactile fremitus. If you lay down for a second, I just want to check and see if there's any masses or anything like that.
Throw these down the floor.
You have pretty reasonable muscle tone in your chest, it looks like. It looks like your stomach is the only issue. Okay. I'm palpating his chest. You examine your breasts at all?
No.
Okay. Believe it or not, men get breast cancer too. So every once in a while, you do the same thing as you do with your testes and your penis, is to check it out and see if there's a lump or a bump. I don't feel anything, any lumps, any masses or anything in his chest at all. You can sit up for me now, Chris. That's what we're going to do for respiratory. I'm going to listen to your chest, and I'm going to listen to see your breath sounds. Probably going to listen to about 11 points on the front and about maybe 15 or 16 on the back. Wherever I touch you, then take a deep breath. Breath sounds on the front are perfectly clear. Just go ahead, sit straight, let me listen. Take a deep breath. Deep breath. There you go. There's no aberrant sounds. His breath sounds are perfectly fine. They're clear. His chest expansion was good, both posterior and anterior. When he took a deep breath, he actually used his chest muscles and not his stomach muscles, which was a little bit different. Okay, I'm going to do a cardio on you. I'm going to check up, see how your heart's functioning. We've already got a blood pressure on you. I suggest that you find a way of taking your blood pressure at least once a day, you know, and see if it goes up and down and up and down and up and down, because if blood pressure puts too much strain on your heart, puts strain on everything you do. It blows out your kidneys if you're not careful. Okay. You know, and I don't want you in this dialysis clinic sitting in a chair, not unless you have insurance. I'm just kidding. Okay.
What's that?
Yeah, periorbitals look perfectly normal. I don't see any swelling around them. Okay, I'm going to take a look at your pulses. Radial pulses are 2+. Just let it down. Let it down for me. Just let it hang, buddy. Popliteal pulses are good. You got 2+ on his pedal pulses. Got very good pulses all the way down. Both pedal and posterior tibial pulses are fine. His carotid pulse was 2+. His radial pulse was 2+. I'm going to listen to your heart, and I'm going to listen to different areas, and I'm going to tell you what I'm listening to as I do it. Okay. There's 5 points on your heart that I want to listen to. That's your aortic valve. That's your pulmonic valve. This is Herb's point. That's your tricuspid valve. You got a slight murmur. Have they told you that?
Yes.
He's got a very, very slight murmur.
Lumpy mitral valve, I believe is what they said.
Yeah. Is that run in your family?
Mm-hmm. Yes.
And who else had it?
My mother.
Your mother?
Mm-hmm.
Okay.
It just the valve doesn't close all the way. Sometimes it.
Okay.
You get that past it.
Okay. Let me see your fingers real quick. Let me see your toes. Capillary fill in both his fingers and toes are less than 3 seconds. His chest movement is normal. Let me see your legs real quick for me, Chris. Just put them down, hang them down. I don't find any swelling in his extremities at all. His heart sounds, we've done the 5 parts, and I heard a slight murmur. Okay. The last one I took, this is the aortic valve, opening and closing. So it's going to, one of the sounds will be louder than the other, okay? And the pulmonic sound will be louder. When I get to Herb's point, the sounds of the thump thump are about equal in sound and volume. When I get over here, then one becomes louder, the opposite becomes louder. And then when I get here, it becomes even more loud, okay? This is your apical pulse. This is your mitral valve that I was listening to here. That's why I moved it a couple of times, just to make sure I heard what I heard. Okay. Now I'm gonna do a neuro check on you, okay? Your demeanor's pretty calm. I find your facial expressions to be within normal for the situation. Do you know where you're at now? Tell me your name.
Christopher McCure,
Okay, and your age.
43.
What's today's date?
That I don't know.
What month is it?
It's April.
Okay, that's fine.
April
He's alert oriented by
9th.
4.
Is it the 9th?
His pupils were reactive. His neck movement was fine. Do me a favor and open and close your mouth. Okay, stick out your tongue. Move it to the left. Move it to the right. To the left again. Out straight again. Tongue movement is normal. And what I'm doing now is when I see you opening and closing your mouth, there's certain nerves, fake cranial nerves, that you can tell whether or not they're functioning correctly based on, this is the glossopharyngeal nerve, okay? And there's 12 cranial nerves that you have, and you can tell by the way people open their mouth, how they open and close their eyes, you know, and everything, all your facial expressions are normal. All the 12 cranial nerves react this way on your face, and so, you know, I don't see any issues, you know, there. Your neck movement and head movement are fine. Your mouth open and closes. Your tongue. Would you stand up and from right here and kind of walk to the end and then turn around and walk back?
Okay.
You walk fine. You're a little leaned over. Is that intentional?
Yeah.
Is that just because of your stomach?
I'm
Okay.
out of sorts because of this.
Turn sideways for me. Okay. He's got a normal concave in the cervical region, normal convex in the thoracic region, and again concave in the lumbar region, which is perfectly normal lordosis for an individual. I want you to lay down.
Okay.
I want you to close your eyes. I'm going to touch you, and you tell me where I'm touching you, whether it's sharp or dull.
Sharp. Foot, left foot. Faint. Right calf.
Sharp or dull.
Dull.
Okay.
Dull. Sharp. Sharp. Dull.
He's got normal sensation bilaterally in both extremities. Do you feel like you have a loss of feeling anywhere on your body except around the scar? Did you lose any feeling around the scar at all?
A little bit.
Yeah. They left you a couple of nasty ones, didn't they?
Well, I got a third one coming.
They're gonna fix that hernia?
Or they'll have to go up further. It's up here.
Yeah. Well, when they fix that, they need to resect your scar, and it looks like it's opened up, not open, but it's not a real fine line. But unless you're modeling underwear, I don't think it's gonna be an issue. You're not gonna be an underwear model, are you?
No.
Okay. Now I'm gonna tap. Go ahead and lay down just one more time.
Sorry.
And I'm gonna do this. Okay. A normal Babinski is toes fed. They're negative. It's a negative Babinski. What I'm trying to do is, if your toes would have curled, you would have had an issue here. That's what happens when people have brain injuries. But it happens with babies. And once they get past a certain point, what happens normally is when I go around your foot, your toes will fan out. That's what they're supposed to do. So you don't have any brain injuries, I'll tell you right now. Sit up for me. We're going to do one more thing here. And put your leg down. You ever having trouble with your reflexes? I get a little bit, not much. Okay. You get a little reflex. Let me see that. axis are normal. Okay, we got a couple more systems and then we're finished. I did an exam before now on the genital exam. I did not want to expose Chris. He's got normal pubic hair covering the genital area. His penis hangs midline, about a half of an inch to an inch below the scrotal sac. He's been circumcised. The dorsal vein is in the midline. His urinary meatus is in the center of the tip of his penis. There was no masses of redness or swelling that I could see. There was no vein distension, and the inguinal area was pretty flat. There wasn't any skin raised or difference in skin tone or anything like that. Perineal area was absolutely normal, within normal limits. I want to look at your abdominal section now, if you'll lay down for me. Okay, what I'm going to first do is I'm going to listen. Okay. Are you hungry?
Yes.
You got bowel sounds in all four quadrants, which is normal. If you don't have them and you come back and you still don't have them, then that's not normal. It sounds like you're a little hungry. I notice that your umbilicus is midline and it's in. That makes you an innie.
Mm-hmm.
Okay, I'm going to palpate and I'm going to try not to hurt you.
Oh, you're fine.
I don't feel any lumps except around the scar a little bit. There's a little lump here and a lump there. You can see where he had his, the ostomy reanastomose it came out here originally. That had to be a heck of a trial for you.
Oh, yeah.
You feel any tenderness?
No.
What is that right there? Is that just
Bone.
That's bone. Okay. Okay. I don't feel any masses. There's no redness. There's no swelling. You can see where the scars have been, but there doesn't seem to be anything out of the ordinary. I didn't feel any pulses either. Normally you'll feel a pulse here and there. I didn't feel anything abnormal, like there's a pulse that was pounding or bounding pulse, and then the abdominal areas, which is within normal limits. What I'm going to do is I'm going to do something called percussing. I want to listen to
Thumbing.
Yeah.
I thump my melon.
Hear the sound?
Mm.
What you got is a little hollow sound, see? That's what you're supposed to have. So I'm not thumping over a mass. And I'm not thumping over fluid like ascites. When your liver fails and you get something, you get hepatic portal syndrome, which your fluid backs up and gets into your stomach, and all of a sudden your stomach becomes like that, and then they have to tap it to get the fluid out. That's ascites. You don't have anything going like that. But you do have some nice scars. I would tell everybody, if I were you, that you were in a war.
Oh, that's what I tell
And
them.
you took
That's my
shrapnel.
bullet wound.
Yeah, it's
I
a
got
bullet
shot-
wound
I got
and shrapnel.
shot. I had to go in and straighten me out.
That's my story. That's my story. I don't see anything abnormal. When I was, you tell me if anything hurts at all. Nothing.
Mm-mm.
You don't get, when I push in or let out, you don't get any tenderness at all?
Mm-mm.
Okay, what I'm looking for is rebound tenderness. A lot of times if you, and I know you told me when I was asking you questions that you'd had your appendix out. A lot of times if you have appendicitis, it doesn't hurt when you touch it, it hurts when you let off of it, when you rebound.
I mean, it was tender after I had the surgery,
Yeah.
but it's
No,
fine
but if
now.
you had appendicitis, what would happen, you would find it to be a little bit more tender when you let up. It's called rebound tenderness. Okay, we've checked your TMJ. There's nothing wrong with it. Sit up for me, please, sister. Okay? I want you to take my hand like this. Pull up like you're doing a curl. Okay? Pull down. Okay? Shrug your shoulders up. Shrug them down. Okay? just sit still. I want to look and see something. Shrug your shoulders up. Scapulas move up and down bilaterally symmetrical. His shoulders move up symmetrically. He's got strong biceps and triceps. Grab my fingers for me. Squeeze. He's got very strong grip. Okay, push out. Okay, pull back. Okay, his leg muscles are strong. Push up. Pull back. They're strong bilaterally. Lift your leg up. That's strong. Very strong. That's strong. Okay, his muscle strength is good. Do me a favor and put your arm out. Go as high as you can. Okay, back down. Okay, do it with the other arm. Okay, stand up for me, please, sir. Okay, go around like this. Do it with the other arm for me. Okay, he's got full range of motion in his shoulders. Can you bend over and touch your waist?
I never touch.
I mean, touch your waist, touch your feet.
No.
Well, close enough, right?
That's it.
Yeah. I mean, what happens when you
Hey,
bend
it's tight
over
on the back.
is your spine, the normal curves of your spine kind of goes away and it just becomes one big curve. And that's the way it's supposed to.
Okay.
You know, I mean, I don't know anybody my age or your age that can bend over and touch their feet. You know, your knees, your patellas are centered. Lift your ankle up, your foot up. Push it down. You've got both flexion and extension. You've got great extension in his feet. I don't know anybody can push it down that. Literally, you could have been a ballerina. You could stand on your toes. I've never seen anything like that. A range of motion in his legs, his ankles. He's got a very nice arch in his spine. If you'll stand up one more time, we're going to finish this up for you. Twist to the right.
Oh, to the right.
And to the left. He's got great rotation in his spine. And that's it. You're in perfect shape. Don't take my word for it, though. I'm just a student. But I appreciate you coming in and doing this.
Quite welcome. I'm glad I could help.
appreciate